Okay, let's start with boys. So in boys, sometimes you find that a male boy is born and then the ball sac is empty. Then you just give it time and then the testes are going to descend on their own. So if you're a mother of a 10-year-old, 9, 8, and then they only have one ball, give it time, it will go down eventually. If it doesn't go down in their adolescent stage, then you can take them to the doctor. And for the adolescents, it's the same thing, right? You can have 2 balls. One would be, they can either be the same size or they can be different sizes. But most of the time, they will be different sizes, right? Right. Sometimes you will naturally have one ball, right? And then when we get to, okay, so this is also say that as you massage your ball sack and feeling for the balls, those are the kind of things you should be checking out for. And then there are more medical things that we check for, like we check for the vas deferens, we check for the vein that goes around the testicles, that wraps around the testicles when you're doing your exam. So you check also if your ball sack is swollen or not. Those are the things that when you're playing soccer and then they hit you there, you know, or you are playing wrestling, or I don't know what stupid thing you were doing. And then if anything happens, the things that you need to check, if it's the ball sack is red, if it's swollen, and then most of the time there's a test that we do, like for example, when Dr. Temba was talking about varicocele, where you put a light, a torch against your ball, and then to see if the reflection or the light rather goes through, right, to see what are the contents of the ball sack. Those are things that you generally check for when you are younger male. But for males who are 45 and above, what you need to do is a PSA. So studies show that for males who are under 40, their chances of getting a BPH or prostate cancer are less. But after 45, they increase, such that when you get to 70 years, 70% of men will develop BPH or prostate cancer, right? So after 45, men are encouraged to start doing their yearly, I think it's yearly checkups of the PSA, if I'm not mistaken. So the problem with these kind of systems is that they have been set up, but they are expensive because you need to do a checkup, or yes, a patient does a checkup, right? And then if there is a problem, they need to do a follow-up. And then after they do a follow-up, there must be an intervention. So you find that some other patients are normally they are living normally with their disease, and then now when they go for a checkup, you discover this disease. Now you have to treat it, even though it's not bothering the patient. That's why the government sees these kind of projects as being expensive, because now some people are comfortable with their disease and it's not affecting them, because some people can have a fully fleshed disease. Scientifically, when you look under the microscope, you do blood tests, this person is sick, but when you look at their body phenotypically, there's nothing wrong with them. Yeah, but so that's where the dilemma is with introducing these kind of projects. And then besides that, males generally have a thing against the hospital. So even if it was a thing that we were to introduce and follow up on, it would not be consistent, because most males wouldn't be consistent on the program.
Mm-hmm. All right. While you're still there, I have a question from Ntuli that says, what are the preventative measures against prostate cancer?
Okay. This one is a hard question, right? So by virtue of being a man, you are most likely to get prostate cancer, because prostate cancer is associated with your male hormones. So as you produce your androgens, your testosterone, those things expose you, or they increase your chances of getting prostate cancer. So if it's not something that you can prevent, but it's something that you can put off for later on, right? So which means if you don't want to get prostate cancer at 50 or 60 years of age, it means you should start having a healthy lifestyle now. Right. So most of the things that affect us, also the 3 major things that are described when it comes to developing prostate cancer, is your age. The older you are, the higher the chances. 2, it's your hormones. Like I said, your androgens, testosterone, and the like. 3, it's your diet. So what you eat determines when you will get the prostate. It's not a matter of if, it's a matter of when, right? So nowadays we have a high prevalence of diseases because of what we eat. Then most people, or most of the food that we eat are genetically modified. Ne? So, which now brings us to the thing, which is prostate cancer inherited? Is it genetic? It is not inherited, it is not genetic, but it can be familial, which means it can run in the family, right? Because my grandfather had a bad diet, he was smoking, he was drinking, then he had prostate cancer. Now my father also ate the same food that my granddad did, and then he's smoking, he's drinking, now he has prostate cancer. And if I adopt the same lifestyle, I will have prostate cancer. So the core prevention method, or the core delay method, would be your lifestyle, exercising and eating healthy, right? There are some controversies around sex, right? Because a certain group of people say the more sex you have, the lesser the chances. Because why? As you have sex, you are releasing your testosterone, right? Then there's another group that says when you're having more sex, you are overworking your prostate. Now, when you overwork your prostate, you expose it to hyperplasia. Now, you know, there are controversies around the sex issue as to which one, less sex or more sex, causes can prevent prostate cancer.
Okay, thank you so much.
Sorry, Ntuli, just to add on what the good colleague is just talking about, just to make the issue of testicular examination much more practical, because we talk the issues of prevention is better than cure. So one of the other practical ways we encourage women to actually examine their breasts, all of that, but and we say for men between the age of 15 going upwards, is to do it really either during or after taking a warm shower or a bath, right? So basically you cup your balls. I'm a practical person, guys. That's why I specialize in public health. You cup your balls. You just have to feel for any lumps or bumps, and you also check if there's any change in size, if there's any, irregular growth around your balls. And over and above that, you need to also check what we call the spermatic cord, the epididymis, right? That is the spermatic cord that is actually holding the balls. You can touch it, that cord, and palpate it and just check if there's any pain and any bump or lump, right? That is just like in a really natural, practical way to check if there's anything. And if there's anything that really concerns you in that examination, you are feeling there's a bit of a lump, there's a bump that was not there before and now that is there, that is a call for concern. Then you can actually take it further and go for a consultation. If there's change in size, there's pain when you are palpating, when you're touching, there's like excruciating pain, this, that, and the other. It does not necessarily mean that you've got testicular cancer, but that's something that's worth looking into so that we can check what the problem is. Is it epididymitis? Is this what could possibly cause you to actually have pain there? So normalize examining your balls. Thank you. On a monthly basis.
When you were saying that you're a very practical person, I almost said if there's a man who would like to try it right now, you are welcome. You don't need evidence of it, but if you like to try it out, you can just try it out. Let us know.
In the comment section.
Why are we here if we are not going to practicalize the lesson? While I still have you right here, Babuntu, what are sexual practices that you feel like, or maybe from your experience, that you would advise against that may affect you overall? Maybe it may even affect your sexual capabilities, interest, power, vigor, at a later stage because of how you were having sex. So it's not a matter of you sleeping around, but maybe even with that one person that you're sleeping with. And right here, I'm trying to not use the word positions, but yes, I'm speaking of that. Are there sexual positions or practices that you as professionals are advising against, that men, and obviously it includes women, should not practice?
I I don't think there's a proper answer to that because it's quite a very subjective kind of a conversation. I think any sexual position is okay provided both partners are comfortable with it. However, I actually really like cautioning men to say now when we then talk about the health of sexual health, to say especially those. Let me just qualify this. I normally caution married men to say often than not, preferences change over time. And what we have then picked up as a trend is that what partners was used to love and enjoy in terms of sexual positions and all of that, that might change over time. And you need to be able to pivot and be able to be flexible enough to actually change with that. Otherwise, if you don't, then you might actually really put a strain on your sexual life and your intimacy life in the context of marriage. So there isn't much, and I mean there isn't even much even when you guys are pregnant. Because I know during pregnancy there are actually certain sexual positions that are very much uncomfortable, especially like a boomer doggy style and all of that. Some of them are actually very uncomfortable. Some of them are actually comfortable, but it depends on the couples, right? So there isn't any, unless of course I have or Eugene, they know better in terms of that. But I don't think there's any sexual positions that we can caution anyone against, because it's actually really the question of, in fact, we are encouraging, especially in the Christian fraternity, we are encouraging Christians to have sex. Those who are married, have sex as regularly as you can, because it's a form of worship, and have it the best way you want to have it, and stop just doing it as a missionary position. This one needs to be married people only.
I wanted to comment, but I was still laughing. Meaning that I was medical questions only. I know nothing.
Why not following the benzo?
I only do medical stuff. I'm a good Christian. The sex before marriage is a sin.
Oh, you not get married? Okay, I'm sorry. Okay,
Yeah.
I get. I pendula get me but to just honestly, there isn't. I mean, both. Whether I'm talking as a medical practitioner or as a person who's married, there isn't any sexual positions that we can caution people about. But we actually encourage them, because positions are basically exploration. You are exploring your body. You are exploring, because there's some that actually.
Can people put food? And we've seen things where women would eat from the man. Can they pour custard and women eat from that?
I'm trying to figure out can men eat from a man part, a woman part. No, of course, there's certain things that would cause trauma. We've had patients asking about the use of sexual toys. Some of them are actually really rough and they're not well lubricated, and they can actually cause, trauma, for the partners and stuff like that. So we really caution them when it comes to such things. But again, what we have learned is that there's nothing that a lubrication cannot fix. However, I think things like food and stuff like that, no. Food, where are you putting the food? In the vagina? So
next thing, you pour custard, and especially when people are having oral sex. I once came across that kind of video. The other one that I wanted to find out is women eating semen. Doctors, what's your advice regarding that? Is that healthy? Is that unhealthy? Does that have a health impact on the person consuming it?
First of all, I mean, semen is protein, but Diseko, you want to talk more about this?
Okay, Mina, okay, it's a personal opinion, right?
Yes.
I'm a believer of what goes out of the body is not supposed to go back into the body, especially into the wrong places in the body. So semen is supposed to leave the penis and get into the vagina, to the fallopian tubes, fertilize, make babies. That's it, right? Then there are TikTokers, there are influencers who would say anything to get likes and have followers. They will tell you to take the sperm and put it on your skin and does what? Probably it does, but until I have proven it myself, I cannot comment on it. It's different, Dr. Temba, from harvesting what you call the stem cells.
Yes.
You take the umbilical cord, you harvest the sperm cells. The stem cells, and then you turn them into something else. It has been scientifically proven. But when it comes to ingestion of sperms and putting them on your skin and having that thing, that could also be something that is subjective because it depends on the person. Because not everybody is using a Dove or Protex because they're not good on their skin. So sometimes, then how many men are you going to go through to try and get the perfect semen for your skin? You see. So it's very subjective also. Yeah.
And over and above that, there's a question of sexually transmitted infections. I think sometimes we take light the fact that we think one can actually get infected when they're having penetrative sex, but there is a risk of infection when you are, there's a risk of infection with even your oral sex, right? And looking into how certain, infections like your HIV and your other STIs can stay in the semen for like more than 7 days or so. So there is that also risk to say what you are then, the big question when people say, do you swallow? So then it becomes a big hullabaloo to those who swallow, to say it's a question of then, infections, to say, if you are sure of the person's HIV status and all of that, maybe that can be debatable. And you're sure that there's no any other infections that they have that are sexually transmitted. But again, as Dr. Eugenia said, it's more of a subjective type of a thing. And strange enough, I don't think there's much research to it, except for the fact that we know that semen is protein, and protein is good for your body, and this, that, and the other. So it's different school of thoughts. So will I encourage women to swallow? I don't know. if they can, if you're married, swallow. And look, and this is a personal thing. Don't go and tagging HBCSA on me and Diseko and calling us out.
This is just Ntuli saying he's okay with it. He's okay, not as a doctor,
yes.
as a person.
Yes, I would be offended if my wife did not swallow. Why not swallow?
I'm pretty sure he's joking, guys. I'm certain he is. All right. So just to remind everybody, those that joined us right now, we are taking your questions. So the questions that I was sharing is questions that we shared before. As we said that when we have a question and answer session, please do share your questions on time so that we can use them as prompt question starters for the interview with the doctors. I do have questions from the comment section. If you do have a question of your own and you would just rather unmute it, please do raise a hand and then you will have an opportunity to ask your question. I have Uslile that says, my cousin was born with a penis that could not open. The foreskin could not open up until teenage years. When he circumcised it, he had rash on the head. After a consultation, he was advised that it's harmless. It was due to the foreskin not opening. Is that normal? tests were done and nothing was found, but it's making him embarrassed. Dr. Diseko?
That is completely, so to speak, normal. What I mean by that, so when a baby is born, the foreskin is much bigger than the penis, and then the penis develops over time, ne? Or rather, there's a corpora cavernosa that is inside the foreskin, so it develops over time. And then when you have, somebody actually wrote it, a phimosis. A phimosis is basically when you cannot retract your foreskin, right? So it makes it difficult for you to bath. The inside is always sweaty, so the penis will become like that. For as long as it is not an infection, it will not have a bad smell, but it will have a certain smell. But if it's an infection, it will have a bad smell, right? So phimosis is one of the indication for circumcision. So once we have done the circumcision, the pineal gland or the crown will be exposed, right? Because of it has been hidden under those conditions for such a long time, it will have that resemblance. It is not everybody who looks like that. And some other people, once they have circumcised, they get better. But some other people, they just stay like that. It is something totally normal.
Mm-hmm. All right. Thank you so much. While you're still here, Nkosinomusa is asking, do the excess conditions that we mentioned earlier affect one to end up being homosexual?
So a brief history. So until the DSM-5 was released, homosexuality was seen as a psychological and a psychiatric problem. So it was deemed as a mental state. So homosexuality is a mental state. That's why people who were homosexual in the olden days were deemed to be, were isolated or admitted into mental institution until the DSM-5 came, right? So now, people who are hermaphrodites, they grow up being male. It's a man who has a penis, who pees, who can have sex, who ejaculates, ne? But then when that man tries to have babies and then they go do tests, then they realize, no, man, when you have a penis, but actually your balls are useless because you have ovaries, ne? Or it is a female who's been trying to have babies. When they make tests, they find that no, this female doesn't have a uterus, or maybe they have a uterus that is not properly developed. So they've been living their whole life being normal males or normal females, right? That's the hermaphrodite. And when we get to the when we get to the XX and the XX male and the XY female, is that physically they look like females, or the XX will look like a female, the XY will look like a man, but their hormones will be different. Similarly, they will have male characteristics or female characteristics that are normal for their kind. But when you subject them to genetic testing, only then will you find out that they have a genetic disorder, which is different from the Klinefelter and the Turner syndrome. The Klinefelter and the Turner syndrome, they have signs, right? So like I mentioned, in the Turner syndrome, they're generally short women with a webbed neck. They have a hairline that is at the back that is almost going down to the neck, right? So you can tell that this person physically looks like they have a genetic problem. Likewise, with a Klinefelter syndrome, you can see from their phenotype, they'll be tall, their hands will be almost reaching their knees, and then you can tell by looking at them that there's something wrong. Yabo. So most of the time, the genes code what happens on the inside and what happens on the outside, but the behavior of the person is not necessarily determined by the genetics, right? So like I mentioned, the hermaphrodites, they don't behave like homosexuals, but then people who are most likely to behave like homosexuals are the XX male and the XY female, because the XX in a male would code hormones for female. So the person would mimic female behavior, and then the XY in a female would mimic a male. but then that is not a reason why people become homosexuals.
All right. Thank you so much. Thank you so much. We will be wrapping up in a second. So if you have any questions, please do ask them now. We are left with 5 minutes for your questions to come in, and then we have to do closure. Ntuli, is circumcision a scam? Or it really works?
I'm trying to figure out why would someone ask if it's a scam or not. No, it's wait. Sorry. No, it's not a scam. I mean, there's quite a number of benefits to circumcision, and that's the reason why we actually went as a country. I think about almost 10 years ago, we started then with NGOs to do a lot of VMMC, which is voluntary medical male circumcisions, right? Because studies then have shown at the time to say there is risk, there is benefits to circumcision, and amongst those benefits is the fact that it reduces the risk of contracting HIV. So that's the first one, right? There's substantial studies that have been proven over the years to say a person who is, because again, yesterday I mentioned the fact that a penis is very much receptive towards STIs and sexually transmitted demons, right? And one of the other main factors why there's so much, reception is because of then the foreskin and the cells around the foreskin. They're quite receptive. So studies then have shown to say if you then circumcise, you are reducing that risk of contracting of HIV. Of course, we still then, encourage people to condomize. We still then encourage people to practice safe sex. However, studies have shown, over the years to say more circumcised, the risk of contraction is a bit minimal, So that's number one. And secondly, for hygienic purposes, as a circumcised man, penis looks better when you are circumcised, and over and above the cosmetic look, and it also for hygienic purposes, because with the foreskin, it kind of harbors a lot of. Think about it. The gland is covered by the skin. That area becomes very much humid, and then you can easily be susceptible to having, especially urinary tract infections, UTIs, your bladder infections and all of that. Because sometimes when you urinate with the foreskin, you don't, retract it, and then you don't titter the penis properly. And then you find that there's some urine that is stuck in that foreskin that is there, and that can actually cause you to have, put you at risk of having urinary tract infections. So it's not a scam in more ways than one, right? It's not a scam. And when it comes to, even sexual activity, right? A circumcised man has been proven to say they are, to a certain extent, they can last a little bit longer in bed than a non-circumcised man, for a number of reasons. The fact that when you're circumcised, you no longer have the foreskin, and now the gland of the penis is now actually hardened, so the sensitivity of the gland is no longer as heightened as a person who is not circumcised. So a person who's not circumcised at that time during sexual intercourse, they will have to then retract. The penetration will then retract the skin, sending it back, and then that will expose to the gland of the penis to a sensation, and that they can actually be easily excitable, and they can actually ejaculate faster. So that is in a nutshell size actually has. So it's not a scam.
Can a person circumcise at any age, right? Or once you have skipped 30 or 35 or 40, it's no longer safe to do so?
Geez, as a public health specialist who have run your VMMC programs and stuff like that, I've seen people at the age of 50 coming for a circumcision. I've seen people at the age of 60 coming for circumcision. And you ask yourself, how? What are you going to do with the penis? But you realize that, one can actually be engaged sexually and have sex as long as they can. It doesn't matter their age group. So yeah, you don't have to, there's no maximum age. Well, of course, if there's other contraindications and other risks. But I mean, if you're healthy enough and you just want to be circumcised, sure enough, come and circumcise. So 30, 40, 50, you know, go circumcise. We encourage men, especially those who are not yet married, to also go and circumcise. Don't circumcise 2 weeks before you're married, your wedding day. It might be a bit tricky, but, you know, we encourage you to actually circumcise.
We have 2 last questions. One from Bax. Please ask your question. Bax, oh yeah, your hand is up.
Today, did you say I must
How are
talk?
you? Yes.
Yeah, sure. No, bengifuna ukuthi la kumphathi the reason why ngibuza it's because of ukuthi mfethu like the reason why you lasting longer it's because of ukuthi you no longer enjoying it the way okube kumele ngawe enjoya ngayo. Don't we think ukuthi uThixo wathi idala wayidala the way ayidale ngakhona and then now we have to take out the skin and then you now lasting longer into ezifana nalezo. So that's why ngithi ukuthi ngifila ngathi i-circumcision i-scam ngoba before umuntu a-circumcise uyi-enjoya ngendlela thizeni and then after circumcision the only advantage ilo ukuthi angisayitholi i-HIV, angisayitholi ama-STI, but then I'm no longer enjoying it. So like you can understand la ngikhona mphathi wami dokotela.
No, I understand, but generally, it has not been proven that people who are circumcised no longer enjoy sex as such. In fact, you get to enjoy it better because now the foreskin, which has got the gland that has got a lot of vasculature and you know it's highly sensitive, and all of that. So you do get to actually enjoy sex even after you've circumcised. So there is benefits to it, and I understand that then there is different school of thoughts. There are some that are pro the fact that Nkulunkulu created me to be like this, therefore I'm going to keep it like that. Again, I mean, the argument is God also created your nails, you know, but we still go to the thingy to cut our nails. You know, God also created you to have your hair, but we still actually cut our hair since I'm afraid yini into yenzile Diseko, yeah, you know.
I don't have time to do my hair, so
I bulala my calls, you know. But I mean, that's the argument to say the fact that you were born like that does not necessarily mean that you cannot then cosmetically or for any other reason alter certain things, especially in the context of a circumcision. Like I said, I mean, we are born with our hair, but we cut it time and again. Of course, one can argue and say, yeah, but the thing is the foreskin does not grow back, you know. But I mean, there is substantial evidence that there's benefits to a circumcision than anything else.
Mm-hmm.
Recognizing
also just to help Bax make this analogy. So Bax, what happens is that the glans has nerve endings, right? I mean, then the nerve endings are covered by the foreskin. So when you remove the foreskin, supposedly your senses are heightened. That's why you seemingly enjoy sex, right? So when you remove the foreskin, the glans is continually exposed. So now your nerve endings adapt to a new environment. That does not mean the sex becomes less enjoyable. It could also be as a result of the type of underwear that you are using, or like when I mean the type of underwear, I'm just saying, is it loose? Is it tight? The material it's made of, and then also the clothes you're wearing. Are they tight clothes, your skinny jeans, your super skinny jeans, or you're wearing relaxed pants? Because all these things, they scratch against the penis, therefore continually activating your nerve endings. right? So now by the time you go and have intercourse, your glands was already being activated or irritated or being entertained, right? So it's not like you lose the ability to have nice sex. It also goes to how do you take care of your genitalia.
Thank you so much. I love that. I have this question from Lionel, but I think we briefly spoke about it. And the doctor did say hopefully next year when we are having a practical, actual face-to-face practical session, he can be able to show that. But just to remind those that forgot, on behalf of Lionel, they're asking, is it possible to help us with tips on how to do the Kegel exercise? That's our last question for the day, for the night.
I was about to say, Diseko, do you want to take this one on? But you told us that when I end up as a sex nan was gay.
Kegel exercise, too. The one most effective Kegel exercise that does not cost you anything is tipa tipa.
Yeah.
You see, if you shapa tipa tipa, that's the best one. And then if you want to get fancy, there's an exercise that most of the guys think it is reserved for women in the gym, which is a hip thrust, right? So a hip thrust, it has a few variations, but basically what you can do a hip bridges. So hip thrust, basically you lie down on your back and then you raise your hips, né? So which means you're gonna have an arc on your legs, on your knees, and then you're gonna raise your hips. You just going up and down, up and down. Yeah, don't take it as having sex with A or anything like that. Just take it as, you know, hip thrusting, right? And then you can change the position of your legs just so that you expose more muscles. But the one that is easier to do and that is most effective is basically your tipa tipa. And like the doctor mentioned, it strengthens your pelvic floor muscles. And then when you pee, you have more control over your stream. Like you can pee better. You can cut it off in a proper manner. When you're having sex, you can have control over your ejaculation as well. So and also it can tighten also your your inner sphincters as well. So it just works the whole pelvic muscle. So if you want to get fancy, you can do your hip thrust, your hip bridges. But no muselaini in your pride, you can shapa tipa tipa, you'll be fine.
You have answered it very well. It's quite practical. So
now,
I'm not
every
gonna
time
add.
I see a person doing it, no, but yeah, when the Kegel exercise, like okay, he's checking out this.
They are getting ready. Yes.
Oh, thank you so much, my absolutely helpful experts. You guys have been absolutely amazing, and I'm pretty sure that everyone that has came to the session from Tuesday have been blessed. To the women, I'm hoping that we are more enlightened and we can be more aware. Those who have sons, who have children, just have those conversations with them. They're very, very important, especially at a certain age. As an educator, young boys are already practicing sex. That's something that you cannot hide from. You don't want to pretend like it's not happening. They are watching porn. So you want to make sure that you really have those open discussions with your children so that they can be comfortable enough to communicate. It's just said that we could not extend the session to speak about things like sexual abuse and how to deal with those. We are hoping that when we do have a psychologist coming in, we can really dive into that and how that has affected many men and those who are married to men who have experienced that. How can you deal with it? Or if God says that's the person that you are likely to be with for the rest of your life. Thank you to each and every one of you that have came to the sessions. We are continuing next week. We are diving deeper into relationships, how men should approach relationships, and of course, understand more women, because sales go to women can be quite extra. We have things that go up and down almost on a daily basis. How do you handle all of that? And what is your role as a man in a relationship, or even outside of a relationship, for those that have been called into a life of singleness? Thank you so much to the experts, Butemba, Eugene. Thank you. On behalf of the Garden Growth team and community at large, we are so thankful that you have taken your time to really grace us. Like, we have been blessed. And I think let's use this opportunity. Let's keep those coming in. Let's unmute everyone. Say hallelujah. Thank God. Say whatever you want to say. Let's just, like, if you've been blessed, please unmute and just say something to thank the professionals for coming.
Thank you so much for an insightful session.
Thank you. Thank you so much. Thank you so much. It's been such a blessing.